right, so for this chapter in endemic is called School Closures and COVID-19. I would like to say that overall this chapter was very interesting. I think it personally we didn't realize how hard COVID affected school closures and how hard it was for schools to even be able to open back up. Um, the sections within this chapter were school closures during previous infectious disease epidemics and pandemics, on the necessity of extending school closures, what happened in the United States, a disastrous policy, um, differences in school policies, United States versus United Kingdom and Europe, and then moving forward, and then the rational, data-driven policies for managing COVID as an endemic virus in schools. Um, so I think some of the things that what thought was the most interesting was uh, it was what happened in the United States. And something that was mentioned was right here. It says the researchers discovered that compared to other countries' COVID coverage, the general U.S. media coverage of other topics, the top 15 U.S. news outlets were 25% more likely to cover any development related to COVID, whether good or bad, in a negative tone. And then another thing that popped out to me in this chapter was that there was a school board meeting, and it was school board members can be seen asking fearful questions about this grim scenario. One board member comments, "My fear is we are going to get both the fatigue and the variant." Yet between January and March, hospitalizations in the region fell by 66%. The school district maintained fully remote learning into April of 2021, despite some of the lowest COVID-19 rates in the country. And then another thing that was mentioned is another significant factor was public rhetoric that sadly and inaccurately pitted those who wanted schools reopened against those who wanted to save lives. Fueling this rhetoric was misinformation promoted by media outlets, which gave a platform to experts who were fitting the data to preconceived narratives rather than trying to determine what narrative most accurately fit the data we had. So from what I'm saying is that the reason why schools didn't open when they should have is because of misinformation and how it was perceived. Another thing that I really wanted to talk about was a disastrous policy. So this section talks about Dr. Jennifer, I'm going to butcher the last name, Nuzzo. She is now at the Brown School of Public Health. So she wrote an op-ed warning that a measure as drastic as school closure would have heavily unintended consequences for society. For example, she said parents might need to quit their jobs to stay home and watch their children, something that would disproportionately affect poor communities and women. Additionally, social service programs that ensure students have nutritious food and a safe place for after-school activities would be disrupted. Education interruptions could further exacerbate the achievement gap between students from high-income families and those from low-income families. And I think that's a very important thing. I guess one of the quotes or something that surprised me was the mental health crisis. I think during 2020 or COVID-19, especially in 2020, people's mental health started to come forth, and we started to bring awareness to mental health. And I think something that we didn't realize is mental health can happen in anyone, and I think we forget that it affected children more than adults. So something in here, it says the mental health crisis among children continued to worsen as the pandemic went on. A CDC report estimated the rate of attempted suicide among girls as 50.6% higher during the winter 2021 than winter of 2019. Suicide attempt rates also increased in boys, though only by 3.7%. One explanation is that females are known to have higher rates of suicide attempts, while male typically have higher rates of completed suicides. Um, so something else that I've noticed in here is right here. It says, in any case, we should never have ignored signs of despair in our youth. Finally, on December 7, 2021, the U.S. Surgeon General sounded the alarm regarding the mental health crisis among our nation's youth. By November 2022, the CDC cited data that showed 3/4 of children have experienced at least one adverse children event, ACE, related to the COVID-19 pandemic response, including abuse, neglect, witnessing violence, or have a family member attempt or die by suicide. And I think we forget how important mental health in children is as it is in adults. And I think that's one of the most things that surprised me.